Hi everyone, this is the third screencast and the last one associated with this lecture. And this one will be focusing on levels of care. So this screencast is associated with one of the other learning outcomes identified or outlined for this class or lecture, describes settings of healthcare and the 5 levels of healthcare in Canada. All right, so the first level of healthcare is health promotion. So again, designed to improve or maintain health status. This level of healthcare focuses on the process of enabling people to increase control over and to improve their health. And again, one of the documents that we looked at and talked about quite in depth about was the Ottawa Charter that included 5 key strategies, and one of them was health promotion. So examples of health promotion are wellness services, anti-smoking education, promotion of self-esteem in children and adolescents, advocacy for healthy public policy or legislation. So the list kind of goes on and on. All right, the second level of healthcare in Canada is disease and injury prevention. So prevention. So illness prevention, disease prevention, risk reduction. So strategies include maybe some clinical actions here like screening and immunizing. There are behavioral aspects like lifestyle changes, support groups, and the third here are environmental actions, societal pressure for a healthy environment. So that's the second level of care. Whoop. And the third one, let's just get this to turn and flip. Oh, we'll get it going here. The third level of care is diagnosis and treatment. So this is where most of the services that we think about and are often used when we think of healthcare in Canada. So this level of care focuses on recognizing, treating clients' existing health problems. All right, so treating health problems, illnesses, diseases. So there are 3 levels actually that are encompassed in this level 3. They're aimed at the individual rather than families or communities. And this is called primary care, secondary care, and tertiary care. So these are 3 levels that fall under this third level of the type of or the level of healthcare that's available in Canada. Okay, so primary care, remember this is at the individual level. Now, before we talked about primary health care, not primary care, which is listed here. So primary care is at the individual level, the first contact a client makes with the healthcare system that leads to a decision regarding a course of action to resolve an actual or potential health problem. So again, make sure you have those two figured out, the difference between primary care, which is defined here, versus primary health care, which was the focus of the second screencast that was provided to you. So secondary care is the provision of a specialized service by a physician or in a hospital, or it could be a referral by a primary care physician. So here's where we need further investigation, where we're seeking a definitive diagnosis. Okay, so someone then is maybe referred to a specialist. That's an example of secondary care. And then tertiary care is specialized and highly technical care in diagnosing and treating complicated or unusual health problems. So there's sophisticated diagnostic equipment involved, complex therapeutic procedures. All right, so let's just try, I've got some photos here and examples. Okay, so this keeps flipping the wrong way. Oh, so hopefully we'll get that right away. Just be patient with me. All right, so here are examples of tertiary care, like highly specialized care, like the Mesenkowski Alberta Heart Institute. All right, that would be an example of tertiary care. Now, the fourth level of care is rehabilitation. So here you're restoring someone to their fullest physical, mental, social, and vocational functioning. The goal of rehabilitation is to assist a client in regaining maximal functioning status, thereby enhancing their quality of life while promoting independence and self-care. So this could include things like physiotherapy, occupational therapy, speech therapy, social services. All right. The Glenrose Rehabilitation Hospital is an example of rehabilitation again, that level of care. The fifth level of care is supportive care. So clients of all or any age with a chronic or progressive illness or disability. So it's a collection of health, personal, and social services provided over a prolonged period of time. So that could include home care or long-term care, palliative care, those who have a terminal illness, respite care. Respite care, again, allowing a caregiver who's looking after maybe a family member who is seriously ill or sick. So the sick person can be admitted to the hospital for respite care, allowing the family provider a bit of a break while their loved one or the person they're looking after is being looked after in the hospital for a short period of time. So when I think of supportive care, why is there an increased need for supportive care? Well, it's really connected to people living longer, more people then having to live with chronic diseases and illnesses. And so some of this then increases the need that patients have for supportive care. So palliative care, again, services for people living with progressive, life-threatening illnesses or conditions. And so this might be an area of nursing that you might be interested in pursuing. And respite care, again, it provides short-term relief or time off for family care providers. All right, so that's it for the last screencast associated with this lecture. So thank you for listening, and I hope you enjoyed this lecture.